everybody. My name is Paula Carnero-Cox. Welcome to another episode of Bitz About Botz, where we bring you actionable insights about how AI is transforming the way we work. Starting with RPA into AI, we have done it all, and we sit with experts who have not only been advisors in the field, but they're also practitioners. So they come with a lens of understanding, knowledge, and are able to share that with our community. So today I am especially excited to be meeting with Karthi, who is a revenue cycle management expert, has been consulting in the field for over 10 years. And she has not only helped with advisors, but also on the implementation side and the strategic oversight of operations in RCM. Hi, Karthi. Thanks so much for joining us today.
Hey, Paula. Thanks so much for giving the time and appreciate all your time.
No, absolutely. Well, we're so thrilled to have you. And WonderBots has always been about outcomes. And in everything that we do, we talk about the technology that potentially is underlying behind the outcomes. But at the end of the day, our clients want us to lead with value. And they want us to bring to the table information about how they can monetize the technology and really get the best benefits out of what it is that they're investing in. And so you provide a unique lens, and I'm so excited to talk to you today about this very niche space that I think is transforming, finally, the way that we're doing revenue cycle management, which actually has impact on not just the providers, not just the way that the payers work, but on the patient. It really gives patients more access and accessibility to knowing that they're going to be taken care of and their insurance is going to do what their insurance is paid to do. So we're thrilled to have you. So excited to be diving into this topic, Karthi. So for a starter, I wanted to talk to you a little bit about AI, right? We would be remiss in August of 2024 to not be mentioning the age of AI. And every client is clamoring to find out what it is that they need to do and how they should infuse AI into their operations. So before we dive into AI, why don't you level set for those who might not know what RCM is, who might not know what this special processing looks like. Give us a little bit of history. Before the age of AI, how has revenue cycle management been managed? Tell us a little bit about the origin story, and then we'll start talking about what we're looking to do today.
For sure. Of course, it's the generation of AI, and every realm and every industry has taken the advantage of AI. But before AI, revenue cycle management always had this manual efforts and manual work being done by starting to code and then to submit the claims. And in fact, even before submitting the claims, to scrub the claims and then submitting them. And then the whole point of denial management, that there is no medical reasoning in the claim, or the coding is not right, and then there is a whole bunch of AR callers sitting there and calling the insurance companies, calling the clearing houses to figure out why the claim was not processed and why the reimbursement did not happen the way it was supposed to. And later comes the payment posting process of RCM, that what is the patient balance, or what is it that the patient has to bear and how much was paid. All of this effort has been manual, and with the advent of technology, a little bit of that got automated, or at least a little bit of manual work was reduced. But of course, with AI and machine learning coming into picture, it's going to change the entire picture and the face of RCM for future.
That's fantastic, Karthi. So you're saying that was when me as a consumer, I go and I have something happen. And if the nurse or the person that's attending me doesn't chart the proper coding and information of what services I received, and then it goes to the insurance company and the insurance says no, then there's a whole back office dedicated to finding out how that gets reconciled.
Yes, there's a big team sitting out there calling the clearinghouse to figure out why it was not paid or why it was not given the exact amount, and then go back to the nurses or go back to the providers and say, hey, you know what, you had provided this service to the patient and there was not enough documentation, or the claim scrubbing guy did not do the right thing. And going back and forth, this AR work has actually increased a lot of stress and burnout for RCM manual resources.
Well, and for the patient on the ground floor, let alone the payers, providers, and that portion of the process, then the patient themselves are burdened with the
Yes,
additional cost of what wasn't
of
paid,
course.
right?
Yeah, of course.
So, and especially I think we've all been so sensitive about healthcare, especially post pandemic. And I hate bringing that up, but it is such an important milestone in us looking at some of these changes that are needed in healthcare. And I
Mhm.
think this really, optimizing any process, with the patient or end user in mind is really the way that we approach outcome based solutioning. So it's been just so wonderful to have you, kind of help and coach and advise us in how we can actually bring health care back to the patient rather
Yes,
than, focusing on, dotting the I's and,
absolutely.
crossing the T's. So, Karthi, tell me
Absolutely.
a little bit about data security. So, one of the things that that's very very mindful in the space of healthcare is patient privacy, the protection of data transmission, and of course any associated, you mentioned documentation. So a lot of that documentation is sensitive, private patient information that's confidential, and yet you have all these different bodies coming together to try and dispute and discuss and talk about patient Paula, for example, right? And all of my information is therefore transmitted, accessible, viewed, validated, and potentially at risk. So, what would you say about data privacy and security
Mhm.
as organizations are thinking of implementing AI? Even outside of healthcare, people are nervous
Of
about the
course.
risk and data leakage. So, help bring a little bit of ease of mind as a professional in this space of how AI truly does answer the question of privacy for patient data.
Absolutely. That's a great question, and that's the need of the hour to know with all this technology coming into place. Am I safe to hand over my baby to the AI or to the ML machine? How is it going to take care of it? And is there potential risk for me? It's a very essential question to ask. Even before the AI realm or the machine learning industry or the changes came into technology, there has been exchange of information. When the information was printed and exchanged between parties, like between the clearinghouses or insurances or the callers or anybody, it was out there available everywhere. And there could be a printout that's just printed out and left without an attending it, or there could be someone who's receiving a medical record request at the clinic for some information that the clearinghouse or insurance is asking for. But with the technology coming into play, as long as the essential cautions are exercised and the parties are well within the boundaries of, let's say, HIPAA and exchange of PHI or PII, of course technology is safe. Like I again stress on the point that as long as we exercise caution, that signing the right agreements and being within the stipulations of regulations of whatever laws, and exercising caution like encrypting the emails and the outputs being sent out to clients are secure emails and not saving passwords, like all the data security rules and regulations gelled with the healthcare IT regulations, it is safe. And we can never say that it is always foolproof, because even if you do it manually or with technology, as long as you do not you do not take the system for granted, it's gonna have its own cost. Especially with healthcare data, it's very costly. So it's always better to exercise caution, and of course, giving the right rules and right tools for the AI to protect data and follow the regulations. It's gonna be safe, I believe.
Interesting point, Karthi, because I had never thought about the fact that data leakage and data privacy was somebody leaving a piece of paper on the copy machine, for
Yeah,
example.
and not attended. And let's say I'm the provider, and I get a request from an insurance company that, you know what, we need medical records for this patient, and that's a PSAC patient, which means that the patient's health information should not be disclosed to anybody. But there's a front desk that, oh, I'm the MA for Dr. A, and I can just read. I got the consent to read anything that comes for Dr. A, so let me read it. No, you cannot, because it's costly information. And so now with technology, you can always have this option of encrypting emails, and only the intended recipients would receive the information. So it's even better when used with caution and when used diligently, I would say.
Well, and it sounds like there's some fail-safe in the technology digital age that weren't available in our facsimile days of transmitting things via paper or any kind of transfer. So that's a really interesting point, that the same type of governance has to be instilled, and it's really still up to, to people to manage. Therefore, encryption might actually be the safer domain for transmitting data, especially of this volume and grandeur, right?
Yeah.
That's so interesting. What an interesting plot twist. I talk about this all day, every day, and it never occurred to me that, we were already solving for GDPR, long before, long before. So
Yeah.
that's so fascinating. So another thing that comes to mind, when we're talking about modernizing a back office or a front office, or just the way that work is done, just transforming it, right? There's always this question of, okay, what do we do first, right? What are the areas that are going to actually give us the biggest yield, the most excitement, take off some of the pain or burden from some of the current workers? So what are some of the areas of the RCM process end to end that are ripe for AI and automation?
Great question again. With my experience of spending like about 10 years of time dedicating my time for healthcare, IT, and RCM, I would just share my 2 cents. And there could be other areas that other experts in the industry feel that, oh, this is not, important, that's important, and it's always debatable too, because it depends on what problem I have to solve rather than what can you solve for me. So I would say reducing this AR work of, having a lot of callers. Usually what happens, or what has been happening in the RCM industry, is they outsource the billing and RCM to an external party, and they have these tens of people sitting and calling, waiting on the IVR, and just, for the clearinghouse to respond. Why all this AR work and AR calling comes into place is because you're not doing the things right at the first place or first time. So get it right first time, so you don't have to invest on rework. That's the first thing, which means that you do the coding correctly first time, you do the claim scrubbing correctly first time, you do the submissions correctly first time, so you don't have to do it. So I would say automating the first easy steps of RCM brings you a lot more value, and reduces the manual effort. And then like claim scrubbing is one of those that we can think of, and then payment posting is another aspect that we can automate, and like patient balances, and then of course coding is to some extent, but again that comes with machine learning, not just AI or just RPA, because it has to learn, the system has to learn, and there are ever changing regulations in the realm of healthcare IT, especially in the US. And these rules, like what CPT gets paid or which service should go for which CPT code, and what ICD codes to be associated. So all of this is a continuous learning process. Even the coders keep refreshing their memory and keep refreshing their knowledge as per what CMS gives. Like every year there are guidelines released. So I would say do it right the first time by automating the first ever steps of RCM, like claim scrubbing and claim submission, and then payment posting. That will reduce a lot of your AR work and the rework that you have to incur, and will maximize the reimbursements. I hope that answers the question.
And I think that this just goes to say kind of what we talk about in general on this series, is that if you have the data properly extracted, understood, and filled out at the beginning of a process, then the throughput is naturally going to be more seamless and efficient, right? And so it sounds like the same is true. Now, for the edification of some of us who might be going into RCM as COE leaders, maybe people who know robots and they know AI, but they don't necessarily know the space, When it comes to, you mentioned a few terms that I think are unique to your space, right? So the claim scrubbing that you mentioned is kind of sounds like a little bit of rework or kind of a redaction exercise. And then you also mentioned coding. So how nefarious and different is coding from one type of doctor to another? Is a dentist different than a doctor versus a surgeon? And is there a universal Rosetta Stone of codes, for everybody to adhere to? So tell us a little bit about the standardization within the coding that could then inform some more structured throughput.
It is standardized. Of course, what codes a dentist use would be different from what codes a cardiologist would use. But as long as the service is provided, there are codes defined, the current procedural codes and the ICD codes, which are for diagnosis. They are all predefined, and those codes are very much like rules. So as long as these are rules and can be fed to a system for it to learn, it can be automated. So I would say it's a low-hanging fruit. Again, reading, let's say there's a scribe that's documenting whatever doctor says, and the doctor says, you know what, I'm burnt out. And all the effort of healthcare IT and digitizing healthcare IT is all to reduce the provider burnout. So they very much use digital scribe or maybe a person who is just there to scribe. Getting all that information into the right codes is the matter. So that's where even machine learning comes into play. And it's not just plain black and white that, oh, I provided a depression screening for this patient, so you code this. Yes, the rule is that simple, but whatever I spoke to the patient is depression screening conversation. So the coder should know, or the machine learning system should pick those words by natural language processing or by language processing models and learn and then be able to convert it. Of course, the success rate of a system when it starts could be a little lesser, maybe around 60% or 50%, but as we feed more and more information to the machine learning model, it's going to be really intelligent, I would say.
So to not overly simplify this, but just to make sure I understand. So it could be, for example, if a doctor is speaking to a parent about their child's tummy ache, and maybe they use the word tummy ache, which is not coded for a diagnosis necessarily, the machine would then have to learn that when you say tummy ache, it really means a gastrointestinal issue, for example.
Yeah.
Okay. So it's just really, it's taking colloquialisms of the providers in the field and making sure that that maps to the proper coding at the very beginning of the process. And that's ripe for automation and AI, which we have seen over and over again.
Also, the complete medical decision making is the doctors, the provider who is providing the care. And when these companies automate systems for the clinics or for the providers, they take their advice, like, oh, whenever you use these words, these treatment plans, what is it that you do? So we usually take those inputs from the doctors and from the clinics and their medical directors, just so that we are not just feeding the system something, but we are actually taking their inputs and training the model. And the same will be approved by those doctors and, those medical directors, just so that we are all on the same page.
No, that makes perfect sense. No, and I'm sure tummy ache was a very silly example, but just to identify how it is that there's multiple ways to say something. And I can imagine, especially in a trauma situation or, something that's very emergency driven, the last thing you're thinking about when trying to save a patient's life is what code this is going to be associated with, right?
Absolutely.
Yeah. So again, bringing the care back into healthcare is one of the things that we're just really excited about that gets to be an outcome of this really good work. So one of the things, Karthi, I think that is very important in understanding, as RCM organizations, there's standalone organizations. There's a whole industry of this, right? You've made your career in that. There's also hospitals that try to latch on to technology to make it easier for their back offices to sort of process some of the remittance of how these things go, paying the doctor, making sure the attending was classified, all of those different elements that come into play there. And then there's also the importance of kind of how the insurance fits into all of this, and insurance is automating and adding AI. And so there's these three unique industries, right? RCM, the provider, and then insurance, who all must work together, but who are also on the precipice of modernizing their own organizations. So how do those dots connect? What is the best way to have kind of that triumvirate really connect in a way that's meaningful for the outcome of the patient? It feels like they should work together to achieve that same goal, but it doesn't necessarily benefit insurance to get called out all the way. It doesn't necessarily benefit the hospital. So how does that connection point work when it comes to technology?
Absolutely. The clinics or hospital systems, clearinghouses, insurances, and patient and provider, all of these stakeholders, if I can say so, working coherently together is very important to deliver the right care to patients. So there are different methods and mechanisms where they share information. Let's say one of the examples is through giving open APIs, or maybe they use automation bots like the RPA bots, like for example, if it's a clearinghouse portal like Avality or Trizeto. Sometimes they give APIs, sometimes they won't. And for example, I can speak for a company that I had worked for in the past, which is a practice management and billing company, eClinicalWorks. So they do not give any APIs to anybody, but there are enough and more players in the market who still find out some RPA-based solution to get the information from the systems and transmit that information to the other systems. Like it could be pulling some information about claims or about the codes that are being used for a patient, or about the diagnosis of patients, and then send it to the insurance company, and then probably from the insurance taking the eligibility of patients to see if what's the deductible, or how much are they eligible for, and what's the maximum that they get paid for this claim, and what are the plans. So all of this information, there are APIs, and if APIs are not helpful, there are ways that we can use bots to do stuff. And yes, they all work coherently with this technological advances.
Yeah, no, that sounds like such a win. Like, what a utopia if we could all work together to give the best care, right? And so much like the precursor to automation in several industries, outsourcing or finding, at a shared service center or something like that to kind of consolidate the AR portion of revenue cycle management has been a trend in years past. Tell us a little bit about what you see coming up on the helm of this industry. Are we closing shared service centers? Are we just modernizing them? Are, we working together? What are we seeing happening to solve this crucial problem?
Sure. Such an interesting topic again. Shutting down the manual effort or shutting down the human intelligence is not going to be there forever, at least in my view of the point. But most of the repetitive work, or most of the work that can have errors if done manually, is all automated or will be all automated. Now, with AI and robotic process automations and machine learning models coming into play in the industry, the errors are going to be reduced, and these systems can go as plug and play systems, or even to the extent that the companies can go to review the processes that RCM company is following and say, this is what is the industry trend that we've been seeing. Do we want to see process excellence and make some value stream mappings and see if we have to eliminate some steps in your process and add some more steps in your process to make it efficient and effective. And as we add more steps, it becomes an algorithm. And as long as it's a step-by-step process, all in for automation. And if there is something that can be learned and understood, yes, machine learning. With language processing and Gen AI coming into play, I would say, there's a lot more that's even beyond imagination that can automate stuff. With all this being said, there will still be a room for manual work, because I'm sure human intelligence is irreplaceable. So how much ever we automate, there's some portion of it, at least some 5% of the outputs and outcomes that needs manual intervention.
No, I totally agree. And I think that's with everything in innovation, right? All we're trying to do is augment the human worker with these fantastic tools that have come on the scene. So that's really exciting. Well, Karthi, thank you so much for your time. I think this has given everybody just a little bit of insight into what we've been cooking up together. And as WonderBots continues to deliver and drive outcomes using emerging technology, RCM is another space that we have gotten very involved in over the last 6 months and only hope to grow in the coming months. So thank you so much for your partnership and support, Karthi.
Thank you, Paula. It was a pleasure meeting you and talking to you today. Appreciate your time.
Thank you so much.